Tonight we're going to demonstrate how to brush teeth and get into position for a child who is 3 to 6 years of age. Sometimes they're active in the evening. Tonight our volunteer has decided he wanted to have his 2 stories in the bed before we brush teeth. He had a choice as to whether to brush teeth first or to read stories first, and he chose to read stories. And now it's toothbrushing time. So our caretaker is going to position him so that she is beside him or coming from behind him, so she can look down into his mouth and see the teeth, be able to get access, and be able to brush gently, very easily. You'll notice we're not in the bathroom. We're on a sofa. That's fine. We don't need to be in the bathroom to necessarily brush teeth. We've already applied the very small, less than a small pea size of toothpaste, and she is brushing the teeth. She has good access. We're near a light source here, and we're going to brush in this position. She can see the top teeth and the bottom teeth extremely well. And she's brushing now, and then sometimes we can change positions. And now we're going to demonstrate another position without the pillows yet. We're going to have him sit between her legs this way. There you go. We can sit back down. And we've already positioned some pillows on the floor. And you can see he's leaning back. And a lot of times youngsters at this age will be a little bit wiggly. So he has his toys out to play with. He's leaning back. He's had his teeth brushed every morning and evening for 3 years now. And so he's used to this. He's used to cooperating and leaning back. And she has great access. She has light. She's able to look down and see the teeth very easily. And she's brushing the top and the bottom teeth again. At 3 years of age, many children have teeth that are tight together. So the toothbrush does not get in between the teeth, and she's going to begin to floss the teeth now. Many children will have spaces between the front teeth at this time, and when you begin to learn to floss, it's a double learning curve. So he has to learn to help, you have to learn to floss gently. So lots of times it's fine just to start with the front teeth, but cavities most often form between the teeth in the back. And once you've mastered the flossing by beginning only perhaps on a good hair day when the child is very cooperative, you'll be able to get to the back teeth very easily with good access. So she's able to floss the back teeth. Many times there are only 4 places in the back teeth that need to be flossed for some young children. Some children need all the teeth flossed, and you only need to floss the teeth that are tight together. Sometimes when the children are pretty wiggly and maybe not as cooperative, you'll notice she'll take her legs and kind of move them over the front just a little bit. Okay, you can see how she's kind of positioned this way. It's just a demonstration of how sometimes if we have we're having a bad hair day or it's late at night and we want to brush that way, there's good access. And it's fine for the child to be distracted with a toy. So this is much better than brushing in the bathroom where it's difficult, or brushing standing and facing a child. She's looking down into the mouth just as if she were looking down into her pocketbook so she could see. Okay, so she's all done brushing, and now it's his turn. So we're going to give him the toothbrush, and we want him to, he can finish brushing himself. Children, even up to age 8 or 9, do not have the manual dexterity of an adult, but we do want them to practice so that they can be brushing on their own. And then when he's done brushing, we'll have him run to the bathroom and spit. He doesn't necessarily need to rinse his mouth. He can just spit out the paste, and they'll leave a very tiny amount of film of toothpaste there so that when he goes to bed in just a little while, the tiny amount of toothpaste, a very small film, as long as you're using a pea-sized amount of toothpaste, could still be there. But current thinking is that's beneficial, particularly at nighttime. And I think he's done a very good job of being a good helper today. Thank you.